Welcome back to Library Orientation, Nursing 1 students. This is part 2. In the first part, we talked a lot about library services and how to look for books and where things are located. Now we'll get a little more delve in deeper to specifics to nursing research. So we're going to talk about evidence-based practice. Now, to give you a foundational background on what evidence-based practice is, I'm going to talk to you a little bit about a Canadian research study that was done in the late 90s, 1998. And what the study did was it asked Canadian nurses what source of information they were more likely to use when they had a question about nursing practice. So this study had 16 options for the nurses who participated to answer what their resources were. So these were the top 6. Now then, there were thousands and thousands. This was a huge sampling across Canada, and most of the nurses had 18 years in the field experience. So this was a real revelation. Now, the top 6 resources that nurses used were, of course, observation of the patient. That makes sense as number 1. Personal experience. When we all have a question, we hearken back to what we've learned and been educated to and experienced in the past. Number 3 was lessons from nursing school, which that's pretty cool when you think about 18 years later. That foundation was still a big part of decision making. Number 4, conference and in-service workshops, which those would be updating nursing information. So that was really good that it came in high on the list. Policy and procedure manuals. As you get into the field and start doing your clinicals, each hospital has their own care sheets that will tell you different procedures and policies. For example, how catheters are placed or different information, fall prevention. So that was pretty expected as number 5. And then fellow nurses. We always refer to our colleagues when you're working together about how to answer our questions. So the next thing, I gave you the top 6. I left some of the middle out, but the final 3 in this study that nurses referred to the least were medical journals, which those were often geared more to physicians. The second to the last was nursing journals, which that is one of the key points we want to remember. And the last was popular magazines, which we're so happy because we don't want our family members treated by Field and Stream or grandpa treated by Cosmo. But the second to the last answer was the question, was the problem. People, the nursing industry itself had to look because nurses were doing things as they were always done. The journals have the most cutting edge information, the credible information. Items are not published in peer-reviewed journals until they are reviewed extensively. So the status quo was no longer acceptable in nursing, and this Canadian study was a big revelation of that. So that's when nursing schools and the nursing occupation began integrating more the research aspect. Thus, why you're listening to a librarian today. So there still remains a big gap between what's being practiced, on the floors or in the hospital rooms, to what has been found and revealed in evidence research. So that's what we're trying to do, is bridge that gap, and that's what evidence-based practice does. So the definition of evidence-based practice is, and you can read that, but it's taking that best available scientific information that I'm teaching you as a librarian how to find in the journals and the academic presses, and then you add that on to your expertise as a nurse, and you add that also in with your patient's preferences and values. So those three legs together form nursing practice. And there's a lot of responsibility for nurses now because they are expected to be able to research and find out what the best evidence is. So that leads to why we're together today, because you will have an assignment like this every semester. You will find a research journal article that applies to, it's an evidence-based study. You will cite that and you will do a presentation. So you want to choose a study. Oftentimes your professors will ask you to choose a study that links to maybe someone that you observed in clinical. But you need to learn how to find these articles or these studies. So they can be found in print and the electronic format. Now, we already talked about by the reference desk or the nursing books. The journals are also there. But that's pretty old school. Some people like to look through them. The information is great, but most of the journal information is in electronic format now. So we're going to talk a little bit before we go and do the actual searches in the databases, some other things that we have to be aware of. When you have evidence, there's a variety of study designs that you have to be aware of. So there's something called the evidence-based practice pyramid. And as you go up the pyramid, the information becomes higher in credibility and quality. So you'll see, some of you may be familiar with some of these type of studies. I always say, at the bottom of the pyramid, you see there's the most, it's the expert opinions. You might have a doctor or a practicing nurse. We're going to say a nurse who is specialized at Johns Hopkins in a specific cancer treatment. And maybe she's had thousands and thousands of patients who she's helped during radiation. So she may publish an opinion on something concerning that process. And that is valuable because she has experience in the field, she's firsthand knowledge, she's tracked something and published a piece of expert opinion. However, that's an opinion. That's not at the level of some of the other studies. So you don't have to memorize these studies. What you do have to know is that there is a hierarchy of evidence. So as you go up the pyramid, those are more what you want to look for. When you get out into nursing practice and you're looking for evidence-based answers to your questions, finding something at the top of the pyramid, the systematic reviews are a compilation of thousands or many studies with large samplings. So that's why they're considered the gold standard at the top of the pyramid. So as you look at each study going up the pyramid, you'll see there are less of them, but they become more credible. Also, you will notice that there's information that is unfiltered and information that is filtered. The filtered is becoming more valuable. So I want you to stop and take a minute. This librarian has done a video that I feel really demonstrates more than what I've said. In fact, I learned from the video, if you can get past the zaniness, on the hierarchy of evidence, because when you are looking for your assignment, you're going to want to understand some of what the study designs are. Okay, thanks very much. Take a break and then watch the Looney Librarian, and then I'll be back with the last part of your library orientation for Nursing 1 in the library. Thanks so much.